My name's Andrew Goddard. I'm President of the Royal College of Physicians. The plan today is to cycle down to City Hall on the banks of the Thames. Along the way we're going to meet lots of people who are really keen to try and get something done about air pollution and climate change in London. Our first stop is Great Ormond Street. We know that air pollution is really important in the development both within the womb but also in early childhood. We're then going to the Royal College of Emergency Medicine. Then we move to the Royal College of Psychiatrists because it doesn't just affect your physical health, climate change and air pollution, it affects your mental health, and that's a really important point that we hope to make there. And finally, we'll cross the river and we'll head to City Hall and hopefully learn the Mayor's plans for air pollution and climate change within London. We've survived the cycle ride from the Royal College of Physicians here to Great Ormond Street, and I'm with a member of staff who is acutely aware of the impact of air pollution on young people. Treating young people is Great Ormond Street's business, and I therefore presume that if that's what they're saying, that the management here are really wanting to tackle air pollution and think about climate change. What's Great Ormond Street doing?
Great Ormond Street has introduced the Clean Air Hospital Framework, which has been introduced to improve the quality of the air in and around the hospital, which also kind of helps the health and environment of everybody, the patients and all the staff working here.
Sandy, you work in A&E.
Yeah.
What is the impact of climate change and air pollution on emergency departments in the NHS?
The obvious thing that we see in emergency medicine is people coming in with really bad respiratory illness, so exacerbations of asthma and COPD, around about the same time that there's high levels of pollution in the air. We also know, looking at the stats, there's about 9,400 excess deaths a year in London alone from air pollution. That's not just the asthma and COPD, it's the air pollution effect on cardiovascular disease and things like strokes and hypertension. Thinking about what we can do in our practice in emergency medicine, I think the main thing to do is to look at the reduce, reuse, recycle idea and just reducing our use of certain things. One key one would be NOx, so nitrous oxide. Following on from our anaesthetist colleagues who want to reduce some anaesthetic gases, the carbon equivalent impact of nitrous oxide is hundreds of times more than carbon dioxide, and we've got alternatives for pain relief than nitrous, so we can just reduce what we're using and that'll make a change. And I think we can be really strong advocates to our patients who come in with respiratory illness, and we can start talking to them about how they're affected by pollution and just highlighting to them that it might be a factor in what's going on.
And one last question. We've just had probably the hottest summer ever.
Yeah.
I can remember being in London on the day when it was 37, 38 degrees.
What a lot of people think about the heat changing is they're thinking 30, 40 years in the future, and it's making changes now. We also know that the heat waves make the air pollution worse, it makes more ozone, and it works together to kind of create this perfect storm of ill health. So yes, definitely something that we need to be tackling and thinking about, and it's affecting us now.
Thank you.
Thanks.
Thank you for your time. Great to meet you.
Yeah, good to chat.
I've arrived at the Royal College of Psychiatrists, and with me I've got the President, Wendy Byrne. Wendy, most people can begin to understand how air pollution might affect lungs, might affect a growing baby, but perhaps less able to think about the big impacts that it can have on mental health.
Yeah. We're seeing it right across the age range, so we're seeing developmental disorders in children, more prevalent in places where there's pollution, and dementia in the elderly. So we're learning more and more about the effects of the environment on mental health, and we're discovering that air pollution is linked with dementia, as you might perhaps expect, but also with anxiety and depression and even suicide.
Okay. So we've arrived at City Hall and we're going to go in and meet Shirley Rodrigues, who's Deputy Mayor. So the Mayor's office and London have been doing a great deal about air pollution. Ultra low emission zones is probably one of the things that people are most interested in.
Yeah.
What difference do you think that ULEZ has made to air pollution in London?
It's made a massive difference. We've just published data this week showing 6 months of data for the operation of ULEZ. And since we announced the intention to bring it in February 2017, we've seen a 36% reduction in NO2 concentrations in the ultra-low emission zone area, and 29% reduction is attributable to ULEZ alone. So it's a fantastic difference.
It's amazing. Brilliant.
It is absolutely amazing.
London's doing well then. What other things do you think other local governments and nationally we should be doing about air pollution?
Well, we've just seen the government publish the Environment Bill, and whilst it's a step in the right direction, we were very disappointed to see that a commitment to, for example, meeting the WHO target for PM 2.5 by 2030 wasn't really formally put in there. So much tougher targets, making sure that the targets are brought forward, that the legal limits, and that we have a good Office for Environmental Protection with the teeth to really monitor that is going to happen and to bring challenges in court and fines where it doesn't happen.
So Shirley, thank you for talking to us.
Thank you very
really
much, and good luck on the rest of your cycle ride.
Thank you very much.